Welcome to My Body, My Bump, My Baby, where we help women be empowered, intentional mothers. This podcast is best enjoyed sipping tea or taking a stroll in nature. This podcast is for informational purposes only and should not be substituted for professional psychological or medical advice, diagnoses, or treatment. Always seek the advice of your physician, midwife, or other qualified health provider with any questions about your personal situation, health, or medical condition. Welcome to another episode of My Body, My Bump, My Baby. Today we have a special guest, Christie Davis. Christie and I are friends from being birth workers. I actually had the opportunity to work with Christie for several years as her home birth midwife assistant, which was fantastic. Prior to working with Christie, I was a doula and doing a lot of births in the hospital, and so it was super, super special and refreshing to get to spend time with her and to have the opportunity to see birth unfold in a home birth setting with a home birth midwife. Hi, Christie. How are you?
I'm doing well. Thanks so much for having me here.
So glad to have you here. And although Christie is a midwife, today we're actually going to talk about birth trauma. But before we get into that, Christie, can you tell us a little bit more about yourself and what you do and how you came to do it?
Yes, I can. I have been involved in birth work for 20-some years. Started as a doula myself, worked into midwife assisting, apprenticing, and then my own practice in which I've been a private practice home birth midwife for just over 10 years. And in that time, I have just really developed a passion for working with birth trauma survivors and just really working into healing birth on the midwifery level by really working my best to facilitate healing experiences for my clients that have experienced previous trauma. And in that, I've decided that I would like to work harder to expand my reach and have taken a lot of trauma training, really specifically centered trauma training, and working through somatic experience training, all sorts of different ways of looking at our bodies and nervous systems in the trauma state, and have created the Perinatal Trauma Center. And that is my program where I work with moms who have experienced birth trauma, their birth partners if they've also experienced that trauma, and I have a portion where I work with providers with burnout, secondary trauma, and compassion fatigue as well.
Oh, wow. That is amazing. And I love the skill set that you bring to this trauma center because you have so much experience in birth as a midwife, and then you have this training in trauma, and to be able to bring them together to be very focused on this particular area, I think is super unique and must be really helpful for anyone you're working with. So you work with providers, which would be like nurses, OBs, midwives, doulas, but you also work with individuals who maybe had a birth trauma experience during laboring for their child, right?
Yes.
And so today we're going to talk about birth trauma as somebody experienced it from a labor experience or birth experience as they're birthing their own baby, or as maybe their partner was birthing the baby. Because you had mentioned partners can experience birth trauma as well, right?
Absolutely.
Yeah, I wouldn't even thought about that, but that makes a ton of sense actually. So I think best place to start is to talk about, what exactly is birth trauma? Because I don't know if many people have coined it. I think that maybe there are a lot of experiences where, someone had a plan. I don't know, I'm giving an example. I'm pregnant. I'm going to go to my doctor's appointments, and they're going to tell me all the things I need to do. And I'm going to do all of those things. And then when it's time for baby to come, I'm going to go to the hospital. And then just like the Seinfeld episode, then yada, yada, yada. And then I leave with my baby and I go home, and it's fantastic. But for some people, somehow in the yada, 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 they come out and they're like, what the heck was that? What just happened to me? I don't feel quite right about this. Maybe.
Yes, that's a very, very common experience. Over 40% of women and birthing people report birth trauma, like feeling traumatized by their birth. I imagine that number is much higher because a lot of people don't necessarily identify with that word. Often that word is reserved for like the big things like war or sexual assault or, things that, that catastrophic C-section in which I almost died, which of course are traumatic experiences or certainly can be. Whereas many birthing people walk out of their experience and just sort of feel vaguely unsatisfied. And that vague dissatisfaction and confusion and outside of their bodies a little bit, and that feeling can really lead into problems with breastfeeding, with problems with bonding with the baby, problems with recapturing their bond with their partner through this process. It can just really spread into all aspects of life. And so quite often I will run into folks that have had a delivery that was fine. Everything was fine. It was good. It was all fine. But that's where we leave it. It's like, yeah, it was fine. And then, what is your satisfaction with parenting? What is your satisfaction with life? It's fine. And these are people who are walking around really stuck in their nervous system in this place of survival that they haven't been able to discharge and come back down to earth and come back into their body and find their power and find their satisfaction with their experience and find their satisfaction with their baby and their partner and all of the things that go with it.
So it almost sounds like for some people, this might be a very clearly identifiable thing. Like, oh yeah, I know I came out of that with, there was a problem, right? But for some people, maybe they feel changed. Their relationship has changed. Something is different. And maybe they can't quite put their finger exactly on what it is. Is that what you're saying? Yeah.
Yes, because I think it's important to note here that trauma isn't necessarily the event itself. That scary C-section may happen, and you may walk away from that experience really fine. You understood why it happened. You were included in the conversations about it. It was okay.
Right.
Or you may walk away from that and be a mess.
Right.
Two different people can have the exact same sort of experience, and one may be fine and one may not be.
100%. I think you have to think about what were their expectations going in, what was their understanding about things going in, and also their previous story, right?
Yeah.
What brought them there. Their whole life story probably plays into this thing. So absolutely, same darn experience, two different people can have very different experiences with it.
Yeah, and the trauma in that lies in the aftermath, really. The trauma doesn't necessarily lie in the event. It lies in the way that we walk out of the event and how we remember the event, how we feel when we think about it, how we feel when we talk about it, what we're noticing happening, are our palms getting sweaty, are, that butterflies in your tummy feeling, or do we avoid talking to people? Do we avoid our friends? Do we avoid going to postpartum yoga because we'll have to share about the birth and we don't really want to?
And these type of things can last a very long time. They can last an entire lifetime. I'm actually, as I'm sitting here with you, I'm reminded of a visit that we did where there was a mama of a mama who was telling us all about her birth story as if it happened yesterday. but it clearly happened a very long time ago, right? But she was still in it. Like, it was still something that she had to work through, that she has not actually been able to, recover from or process yet. And so some people, maybe it's, I don't want to talk about this at all. And then some people are holding it for years and years and years, and they just kind of relive it through talking about it over and over again, right?
Yeah, we really seek to heal our traumas through storytelling. That's a huge component. But the problem can come in when we're telling the story without being aware of our nervous system and what's happening in the body while we're telling the story. Because if we're not, we're constantly re-traumatizing ourselves.
Yeah.
Every time we tell the story, instead of healing, we're just re-upping the trauma,
reliving it without resolution.
Yeah. And so, our nervous systems always orient towards safety. We always want a way out. We always want a discharge. But without sort of intentionally knowing how, or even just intentionally trying, we can't do that, or we don't do that. Either one. We can be our own worst enemy there.
Right. So it sounds like this has a lot to do with the nervous system and how we are experiencing an event.
Yes.
So tell me more about that. How does that work?
Yeah, it has everything to do with the nervous system. And I think one of the most clear examples that I can give is in the animal world. Animals don't experience trauma unless humans get in the way, as in the case with abused dogs. We teach them how to be traumatized. That's pretty sad, huh?
Right.
But in nature, left unblemished, animals don't experience trauma. And the reason is, when there is an actual threat, they respond to the threat, and then they discharge the threat, and then they go back to normal. And so if you consider antelope grazing on the savanna, and in that place, they're in their calm, collected state, and it's a state of appropriate social engagement with the world around them. They're sort of working as one unit. One antelope will sort of wander off one direction, and the rest will follow, and they stay together. This is sort of the state that we want our nervous systems to be in. This is our calm, at ease. Our vital signs are doing at their optimal levels. The body is functioning optimally. GI system is working great. Breath is working great. But then let's say that a lion comes along and starts to attempt to eat an antelope. The first thing they do is scatter.
Right.
And so their first mechanism of survival is to slip into fight or flight, or the sympathetic nervous system kicks into gear. And in order to survive, one of the first things that goes away is that ability to interact appropriately with the world around you from a social perspective. They flee and they scatter as a mechanism of survival.
Right.
And so they're doing that. They're fighting, they're fleeing, and let's say the lion catches one that's a little slower than the rest or whatever, and the lion catches this antelope. Well, the antelope may struggle for a while. That fight mechanism may still be alive and working, but then there's a point where the animal will go into what we call shutdown, where the nervous system is giving its sort of final last-ditch effort to survive this experience by completely shutting down. Vital signs slow down. It's more or less a preparation for death.
They almost look like they're dead, right?
Yes.
But they're not.
Yes.
Right. Uh-huh.
And this can work because the lion wants prey that fights.
Right.
And when the prey stops fighting, sometimes the lion loses interest.
Right.
And at that point, the lion will then set the antelope down and go on about its way. And there's one thing that animals universally do in the moment right after that. Do you know what it is?
Shake it off?
They shake it off. Exactly. Yeah. And that shake it off is the nervous system discharging. That's this discharge where, okay, the threat's over, and now I can go back into my calm, cool, collected state of appropriate social engagement with the world around me. The herd comes back together. Everybody's grazing as if nothing ever happened. So like,
except for Joe almost got eaten.
yeah, but like, so what?
Lucky
Joe
Joe.
didn't. So
Lucky Joe.
like, now we don't have to think about that anymore. Like we
Right,
don't
right.
have to hold on to that.
We move on. Yeah.
But human beings, we have this lovely ability to live in the world of perception of threat and perception of danger.
Yeah.
And so when we have a nervous system event like a birth, whether it's gone perfectly or not perfectly, our nervous system does get activated.
Right.
In normal circumstances where everything went well, our nervous system discharges. I often wonder if that's that hormonal shakes after the birth.
That makes so much sense.
The nervous system, trying to
Yeah.
like shake off the experience and then be present to regulate for the baby.
Right.
But sometimes that doesn't discharge. Sometimes an event happens during the birth in a certain way that it just stays stuck. And so we never get to that place of put the antelope down and shake.
Right.
And we can go on in either of those states of being either fight or flight or shutdown for a long time. And we can talk normally and act normally and go through the motions. But inside, our nervous system is still looking for that threat. We're still trying to figure out where is this threat. And we're constantly on guard.
So it's still in an activated, like, threat state.
Yep, we're
essentially.
still there.
Right.
We haven't discharged.
Right.
And so the goal of trauma work is to facilitate that discharge. Let's find where that trauma is lying. Where is that state of activation? Where are you perceiving threat? Let's find that and let's discharge. And once we can help the body and the nervous system understand that it's safe, we can start sending that message to the frontal cortex.
Wow, that's intense, actually. So who might experience birth trauma? Is it reserved for hospital births only, or can anybody have birth trauma? And like, can you almost know, like, if somebody was to tell me, here's how my birth unfolded, can I listen to that story and based on the details of that birth say, oh yeah, you probably have trauma, or maybe not?
Yeah, those are both really good questions. To answer the first one, anybody and everybody can experience birth trauma. I actually, in my trauma education, so 14 years after the birth of my daughter, identified trauma in her birth.
Oh, wow.
It was a beautiful and perfect home birth. Everything went great. Reasonable labor length, 6 hours, pushed for maybe 10 minutes, had a 9-pound baby, and everything was fantastic, right?
So, like, great.
Yeah.
Sounds like a great story.
Yeah,
sounds
well
like a great birth.
supported,
Yep.
wonderful midwife. But for about, I'd say 18 months after that birth, I experienced anxiety attacks that would just come on in the middle of the night, and it was all about dying, just like the fact that I will die one day, and that was really scary to me. And what I finally realized all of these years later in this trauma training is that, and I remembered this, I just never connected them. There was a moment, and it probably was 30 seconds. It was probably in between two contractions when I was pushing that I really thought I was dying. Like, I was like, this is too much. My body can't handle what's happening. This sensation is too intense. I'm leaving my body. I'm dying.
Oh, wow.
And then I had a baby, and then everything was fine and perfect. And so I just never connected those two. There were some other events in my life that I sort of tied those anxiety attacks to. But as I started working into trauma, I realized it was, a beautiful birth. But this moment, my nervous system became activated, and I never acknowledged it. I never gave that moment the attention it needed. I never paid attention to that in the future.
Right.
Because I just didn't think it mattered.
Right.
But it turns out it was big enough that it stayed with me for a long time, and who knows, may have even spurred me to go into trauma work.
Right.
I mean, we're in the Carl Jung theory, it's the wounded healer that, we are healing our own wounds by healing the wounds of others.
Right.
So, who knows, maybe I'm following Jung's footsteps. But yeah, once I made that realization and just sort of sat with it a little bit with some of the training that I had, I was like, oh, that's it. And I've never had another one of those attacks, and life goes on.
Right. And then it's not something that you're plagued with anymore. The thing that's so interesting about your story is it sounds like you had a very nice birth experience, and it sounds like it was an environment that was comfortable to you and you had good support. And yet unknown or unidentified, clearly there was an issue, but like your cognitive brain had not kind of put the label on, oh, this is what this is from, yet 14 years that you had to cope with this thing, and you could not quite put your finger on what is causing this. Why am I having this, these panic attacks? And that's wild to consider.
Yeah, that our bodies can hold on.
Right. Well, and also that maybe, this has happened and we can't quite put our finger on that particular moment in time, like the thing that comes up for me, like I'm starting to think talk therapy, right? Right. If you go to somebody who wants to do talk therapy, then, they want you to talk about, why does this come up for you? Or did you notice like what was happening right before this came up for you? And you're talking, you probably would spend a lot of time just trying to figure out like, what is the root of this issue? And maybe sometimes you can, and then maybe sometimes you can't.
Yeah. And really, depending on the therapist, you need to be with somebody who's really trained to notice the activation. Because as you're talking through your story, you will become activated again if you haven't discharged. And so being with a therapist that's really qualified to like notice that activation is really key. And while I'm not a therapist, I, again, have specific trauma certifications, but have not done, a licensed therapist degree or anything like that. But what my specific training is in recognizing and discharging activation. That's what we're doing when we work together, is noticing, okay, well, I see when you tell me this part of your story, if I was talking to myself, let's say, I see when you talk about pushing, you start to shift a little in your seat. Like, what does that feel like, that memory of that experience? And then you'll get people telling you all sorts of things that they never thought of. Like, well, yeah, actually that was kind of scary. I had this moment where things didn't feel right, and then they were fine again. And then we can look at that moment and we can find it. It's super fascinating. I worked with a woman a while back she was about a year postpartum, and she had a persistent pain in one of her legs, in the thigh. And as we were working through her birth experience, she had experienced a really bad hemorrhage. Mm-hmm. And it was an out-of-hospital birth. And, she was the care team was like working on this. And the moment that we isolated that she really understood how bad it was and that she was in danger and that she was not safe was the moment that the midwife gave her an injection in her thigh of Pitocin.
The same thigh that had been hurting for a year?
Exactly.
Wow.
And as we sort of worked into that moment a little bit, and she was able to really work with that knowledge that, okay, this is the moment in which I became activated, that I thought, oh, I'm not okay. And as we worked through the deactivation of all of that and the discharge of all of that, she reported to me that she no longer had pain in her leg.
Just like that?
Yeah.
I mean, once you finally got to that root, it was like, boom, that was it. Okay, we figured it out. It's released and no more pain.
Yes.
Wow.
And that is, to me, the coolest thing about this work with trauma is trauma can be cured. And it's not always as straightforward to find the moments. Sometimes it takes a little more work and time to sort of figure out where those are.
Right.
Especially in the case of people with developmental trauma, maybe a history of past sex assault. And sometimes people don't even have knowledge that happened to them. So
Right,
sometimes there's some
right.
pretty deep layers. So it's not always quite that straightforward.
Right.
But always when we get to the place, we can discharge it.
Wow. That just sounds like it could be such a relief if you were struggling with something for so long. Like going back to your example, 14 years of these panic attacks, and for it to just fade away, just to be gone. I mean, just like that. It just sounds like it would be such a massive relief.
Well, and I will say I did not necessarily experience the panic attacks for 14 years. That was about 2 years,
okay.
once or twice a month. Because, time does do a great deal as far as healing goes. But it's not to say that it takes it away completely. So
Right.
I don't want to, lead with this fear of like, ooh, if you don't get this figured out, you're like stuck in this, because it's not necessarily that acute.
Okay.
But it was still a really profound realization to understand, like, that came from something that I thought it was from something totally different in my life, and it turns out it came from here,
Wow.
from this birth.
Right.
And like I said, to really sort of alter the course of my life in a really positive way. I mean, to go into this work, but it just is so interesting to me that very well could have been what drove me there.
Right. Right. Into this work that you're now doing.
Yeah.
Yeah. So here's what I'm wondering. You and I have had the opportunity to attend a lot of births. I've had the opportunity to attend a lot of hospital births. I clearly was able to see that the way birth unfolds in a hospital setting versus the way birth unfolds in a home birth setting is just very different. I think for the fact that you have to leave your house and go to a new location, right there, that in itself makes it very different. And so for me, coming from a doula perspective, my mind, as far as like, how does birth trauma occur? My mind would go directly to, well, potentially not feeling safe or maybe not feeling heard and supported. Do you find that it's mostly related to those type of things or not at all?
So it is always related to not feeling safe. Now, it's just a matter of what does that look like? I think that for some people, going to the hospital is a really scary place and it can make them feel very unsafe. And for some people, that's where they feel safe and
Right.
comfortable enough to let their body do this work.
Right.
And so it has very little to do with the location.
Mm-hmm.
It certainly can have to do with the birth team. More often than not, any trauma that comes from outside, either from your partner, from your clinical care provider, from your doula, from whoever, when trauma does come from there, more often than not, it's a simple lack of communication in which that provider or support person said something that they meant as supportive, but was
received in a different way.
In a way that
moment.
made the birthing mom feel unsafe.
Right.
So it doesn't necessarily come from external sources. It absolutely comes from something making the birthing mom or the partner feel unsafe in the experience. In my example that I gave, it was my own body. Mm-hmm. My support was great. But I also know of times where I just recently in a seminar that I was doing in Dallas, a midwife assistant was talking about a case that she had where the mom birthed standing up. And this mom really didn't want to do that. She had a very clear image of like how she wanted to birth, and standing up was not it. And in their debrief, that midwife assistant made some comment about like how cool that was and how like she's like, I've just never seen anything like that. It was amazing. And she was trying so hard to be the cheerleader for this mom. But what this mom heard was, you're unusual. That was not normal.
Oh.
And that statement was really deflating for her
Oh,
instead
wow.
of encouraging.
Yeah.
And so, for any providers out there listening, I don't say that to make you terrified of the things that you say to people, because we can't always control how information is received.
Right.
We do the best we can. We're trying to be cheerleaders, and sometimes that's taken wrong. But the point that I'm making is that for this woman, a really kind, well-meant statement sparked a feeling of not being safe. I'm not normal. My birth wasn't normal.
Oh, gosh.
So like I said, not to spark fear into those of us supporting birth, but just that understanding of, yes, it can really come from anywhere, anytime.
Right.
And, this mom went on to not necessarily need, trauma work per se. A lot of stuff we are quite capable of discharging on our own without that. Where that would come in is if we find that we're dwelling on it. Even, just these vague feelings of confusion and dissatisfaction with our experience. Maybe it's time to sort of look into that a little bit.
I can see that. It's like the 4 Agreements. Have you read that book?
Mm-hmm, I have.
So, I can see that being easily taken on as an agreement.
Mm-hmm.
And then once it's an agreement, like, oh, I'm unusual.
Yeah.
Then you kind of perpetuate that agreement within yourself and just like, or you have to have awareness to not perpetuate or not take on that agreement. One of the things we were talking about in a past episode about birth is, the birthing person is very open in a lot of ways, energetically open, spiritually open, emotionally very, very open as her physical body is opening to push a baby out. And so it's really easy for things to really land deep inside that maybe they have to process and work through afterwards.
Yeah, and if you consider after this massive experience in which we're so open for so much to come in, even as things are coming out, then we're supposed to go home or stay home, whichever, and be the regulatory body for this baby.
Right.
And we are feeding this baby from our body if we're able, and even if we're not feeding the baby from the body, we're skin on skin. We're literally teaching the baby how to be in that calm, cool, collected state of appropriate social engagement with the world around them. Now, if we're stuck in fight or flight or shutdown, and we have broken out of that place of appropriate social engagement with the world around us for our own survival, what are we teaching our baby about their nervous system?
Right.
And I know that feels like maybe a lot of pressure to people listening, but it's also a lot of power.
Right.
Because we can fix everything with nervous systems. Is this a good time? Would you like a little example of maybe some?
I'm curious when you're talking about that, would you notice symptoms with the baby? Like,
oh, absolutely.
Like first thing that came to my mind, right, is the diagnosis colic. The colic is like, we have this baby that's fussy and we really don't know what the heck is going on with the baby. So we're just going to label this baby colic. And so now I'm kind of wondering like, like, could those kind of symptoms be related to this feedback loop between mom and baby?
100%. And I don't necessarily work with newborns, but that for me is where craniosacral work can be really helpful for outside body work. And my work with getting birthing people into a regulated body, in turn, will now help the baby know how to regulate their body.
So then in this case, it would almost be 2 bodies.
Yes, 2 nervous systems.
2 different kinds of support, right?
Yep. Yeah, and it's an interesting thought to think 2 different kinds of support, or is it 2 bodies needing the exact same kind of support? I don't really know the answer to that. It just gave me some curiosity. I wonder. But
yeah. You had an example you wanted to share before I threw out my question. Thoughts.
I just would like to take a minute with you and me here and anybody listening to just give an example of a way of regulating the body. Some of what we've talked about is probably pretty activating for some people, and people may notice those feelings of, maybe the butterflies in the tummy, maybe your palms are sweaty, maybe your breath has changed a little bit. And so I would invite anybody listening, you can try it too, to just grab your arm with one hand and your shoulder and just sort of squeeze a little bit and slowly work that hand that's squeezing down the arm. And as you're doing that, take a minute to notice what kind of pressure you're using. Are you squeezing hard? Are you moving fast? Are you moving slow? And taking just a moment to notice, in this scenario where I'm squeezing my arm, am I the one touching and squeezing, or am I the one feeling and being squeezed? And as you do that, noticing the fact that you are breathing and what that feels like. Even breath can be a very activating action for people. And so not to assign anything to it other than curiosity, but just notice that you're breathing and notice that you're squeezing your arm or that your arm is being squeezed. And then once you feel like you've experimented with that enough, just taking a moment to notice if your body's changed, if anything has shifted in your system. Did you notice anything? Were you the squeezer or the squeezy?
Well, can I just say how, like, when you asked that question, I was like, what? What? But yeah, I was actually being squeezed. I was not the squeezer. So that's really interesting. It's not even something I would have ever thought of.
Yeah.
I'm like, oh my gosh, that is interesting. So I was receiving. Mm-hmm. I felt like I was receiving. And then afterwards, I actually feel like relaxed. Mm-hmm. Maybe my breath slowed and calmed a little bit. So yeah, I felt calming from it.
Yeah, and that's just a level of discharge. As we sit here and do this podcast, there's a level of activation, right? That we're playing off of each other and we're doing it with equipment around us, and neither of us know 100% the direction things will go, right? So there's a potential perception of threat there and an activation. And so if we can bring ourselves back into our bodies as we talk, it makes us more effective communicators.
I like that. Is this a technique that you guys use, like, to help people settle, or does it always give that kind of settling response, or not for everybody?
I can't say that it does for everybody always, because there are always variations. I don't know if somebody had an arm injury and grabbing their arm would be very triggering. Yeah. We have to be sensitive to that. But typically, once we do some sort of very safe self-touch, what it does is put us back in our body. If we become activated and we are just sort of flying away, if we can do some sort of soothing self-touch, it's anchoring. It brings us home.
I like that. Nice. I'm wondering, is birth trauma avoidable? Like, is there anything you can do to like I don't want to have trauma, right? Nobody really wants to sign up for that. Right. Is there anything you can do to avoid it?
So I think the best things we can do for ourselves for self-care through a birthing experience is to be aware of our system, just to know ourselves and to understand activation. The sort of like logistical things we can do is do our best to surround ourselves with people who make us feel really safe, safe to be vulnerable around. If you have chosen a hospital or a birth center with rotating staff, understanding that you may not have ultimate control over who's coming into the room, but knowing the environment well enough that it's going to feel safe no matter who it is. Having that continuity of care person like your doula or even your birth support, your partner that is going to be that person that's going to be with you through it all. Just really setting yourself up for being in an environment that feels the safest based on your knowledge of that. And knowing that at any moment things can change. And we can't necessarily prevent trauma from the perspective that, oh, well, I'm just not going to have a C-section, or somebody's not going to say something weird that makes me feel activated. But having that understanding of nervous systems and activation and how it all works can help with that immediate discharging. I think in my midwifery practice, one of the most important components of it is doing debriefing after the birth, is to sit down and say, and I'll do this with my midwifery patients on day one and usually somewhere around a week or two,
right.
When some time has passed, and say on, that immediate day one, do you have any questions about what happened? How are you feeling, about your experience and what happened to you? Because it was a huge event.
Right.
How are you doing with that?
Right.
And, at that initial one, people are often still sort of riding high on those hormones of having their baby, or it went very much not as expected, and they are like really needing to be picked up off the floor. And then that can change a week later. And so while we can't necessarily prevent trauma, we can keep it from following us into life and into our parenting journey. And there are fairly simple ways to do that. Much of that comes from debriefing.
Okay.
That can be a little more difficult with hospital providers that are on rotation, just simply because of the way our medical system is set up. They don't necessarily have the time for that.
Well, and they're often not actually attending the majority of the birth experience as well. So they would have like the last 15, 20 minutes or something, but they actually wouldn't have the whole story. It would have to be somebody else who was there present with that person.
Yeah, or finding somebody that really does birth debriefs, or, even working with your partner, if you have a partner, and saying, can we just sort of talk about what happened? Like, what was your perception of this? And as long as the partner isn't activated as well, that can be really healing.
I love when people hire doulas. I don't know if all doulas do this, but when I was active as a doula, the postpartum visit would typically occur 7 to 10 days after the birth, and we would do this. Mm-hmm. We would tell the birth story.
Yes.
And just talk about, where are like the missing puzzle pieces that need to be filled in, and allow everybody to ask questions about, why did this happen, or how did this happen, or, just, any questions that might come up. And I do think it is very helpful, especially when you have somebody maybe like yourself who has a lot of birth training and a lot of birth experience, to be able to talk to somebody like that. Because oftentimes I think maybe as we go through it, if we don't have that kind of experience or that kind of training, our brain is trying to fill in the pieces of the puzzle and help us to understand something. And sometimes it does it in a way that's not very realistic or is kind of blown out of proportion. And I feel like it's really nice to have a professional who can either validate that or explain, oh, actually, no, it was not, this really scary situation. After all, it was very normal. It just felt big, or, just kind of being able to bring clarity to that. So the other thing that came up for me when you were talking about how to avoid birth trauma, you really highlighted ensuring that you are creating a birth experience that allows you to feel safe. So the people around you should be those people that you feel very safe around, that you can kind of be very vulnerable around, including your care provider. So the thing that came up for me as I was listening to that is, I hear in our prenatal yoga class often when people are not quite connecting with their provider for one reason or another. Maybe they're not on the same page. Maybe they're feeling like they're not being heard, or they're feeling like they really have to work hard to advocate for their goal birth all of the time. For that person, if that person is listening today, Is there any advice you would give to them?
Interview other providers. I caution against provider hopping throughout an experience because that's simply going to add to that feeling of not ever feeling anchored or safe.
Right.
But, if you've really given your best effort to work on that communication and it's just not working because there are just communication styles that don't mesh, maybe it's time to look into a different provider. It is absolutely appropriate to change in your pregnancy. But, again, sort of make sure that you're doing everything that you're doing in that from a really mindful and intentional place of like, okay, I really feel like I have communicated in my best way with this person and I trust that they're communicating in their best way, but it's not working between us. So look into different providers. Do your best to set yourself up in a place where you feel heard, understood, and supported because that's what leads to safety.
Yeah, I love that.
And safety, frankly, leads to efficacy in birth.
Right.
When we're in a state of heightened fight or flight or shutdown especially, our bodies are trying to survive. And so in a body that's trying to survive, that can mean either like throwing a baby out there real fast,
right,
or holding a baby in,
right,
just not letting a baby out because it doesn't feel safe.
Right. Here's another thought. If I'm a listener and maybe I am currently pregnant with baby number 2 or baby number 3 or baby number 4, but it's not my first, right? So it's another baby. And I'm listening to this and I'm kind of feeling like, you know what? As we're talking about this, I started to feel some stuff and I think maybe I do have something connected to a previous birth experience. Can that, if there is trauma that has not been resolved or identified and worked through on a previous birth, can that affect this pregnancy and this birth?
Yes, it can. It can, and it will. Not only can it, but it will. The level of that varies person to person. But I would say that my practice is mostly filled with people that are on a subsequent birth and are feeling really activated as they go into the idea of carrying a baby and delivering a baby again, based on their previous experience. So many of these folks have actually done work around that first experience. And, the thing with trauma is that when we're in one place in our life, we work through it, we're feeling great. But then circumstances change, life changes. Now we're back in that position of, now I have to carry another baby and deliver another baby and breastfeed another baby. And we can go back into that trauma activation, that reaction. And so that's, like I said, most of my practice is people that have experienced a previous traumatic delivery and need to work through that before facing their next birth.
So not wanting to make an assumption, I want to ask, can somebody who is in those shoes, so subsequent pregnancy and is feeling like, oh gosh, there's some stuff that's coming up from a past labor, can they work on it while they are pregnant with this baby? Mm-hmm. Is that something that can be done?
Yes, they can. And often do. I have had a couple experiences actually over the last few years in which I've had somebody come to me, and my program is a 4-week program, and we do that. And then I always offer tune-up sessions, like as they get closer to delivery, maybe they need that, like, oh yeah, I'm getting closer and I'm feeling it a little, I need to like have a little reminder of this work. And they come back to me, and several times, like I said now, I've received photos of sweet, juicy babies within hours of those sessions.
Really?
Yeah, with these birthing folks who say, yeah, we did that tune-up, and I was feeling really good in my system and in my body, and I went home and contractions started, and I had a baby a few hours later.
Wow.
And, like I said, it's happened enough times that I know it's not a fluke. And I just this work with nervous systems and our body's ability to come from that place of safety and regulation and the amazing things we're capable of when that happens. I also, in working with some folks with postpartum issues, breastfeeding issues, I worked once with a woman who came in, and she was mainly with me for breastfeeding issues. And after her very first session with me, went home and latched on a baby that had never latched before, and they stopped needing bottles moving forward from that moment.
And that was not a birth-related trauma. It was something else, but it still fixed the breastfeeding issue?
At the end of the day, it was birth-related.
Oh.
She thought she was coming for just breastfeeding, but
wow.
it all goes together.
Oh, wow.
You know, when you're trying to feed a baby in a system that's stuck in fight, flight, or freeze, it often doesn't work as smoothly as it could.
That goes back to what you had mentioned earlier, that mom and baby kind of feedback connection, that feedback loop. Wow, that's amazing. So if one of our listeners, or if any of the listeners, have experienced birth trauma, or maybe today after listening to us talk, they're realizing that, oh man, I think maybe I have experienced some birth trauma. What is their next step? What should they do?
Yeah. Well, I would love to recommend myself for a next step. But in general, I mean, just being able to find somebody to process the experience with who has understanding of trauma reactions and nervous system reactions and what's going on in the body. For the babies, like I said, I really love craniosacral work. I just think that that's such powerful work for their little systems. And for the moms, birthing people, and the babies and birthing partners, anybody involved, doing that processing where we can start to work on discharging that event in the nervous system is what I would absolutely do first.
So we are located in Colorado Springs, and you are the founder of the Perinatal Trauma Center here in Colorado Springs. Mm-hmm. Do you have the ability to support people all over the nation, or is it just Colorado Springs?
No, I do a lot of work by telehealth.
Okay.
So in the Colorado Springs area, I have an office, but I can support by telehealth. This whole program can be done that way.
Okay, fantastic. So wherever you are in the United States, they actually can reach out to you and do some work with you. Maybe they're not quite sure. I think I'm feeling maybe, yes, this is something that is going on with me and I might need to do a little work on it, but I'm not quite sure. Is there anything that you could offer for that person?
Yes, on my website, just sort of towards the bottom of the main page, there's a self-assessment that you can fill out. It just has a few questions that are geared towards assessing trauma on a very superficial level, really. But I answer all of those myself. I read all of those and answer personally. And so that's a really great way to sort of open up communication and sort of figure out maybe I do need to do a little more work. Or I answer those questions and I'm actually really feeling fine. Okay. I've gone through my program a couple times with people that have been curious, and one of the things we've realized is, hey,
you're doing good.
You're doing great.
Yeah.
Which is also a good thing to realize,
Sometimes we just need validation.
Yeah.
And validation is another way of healing, right? If you're in the state where I think I'm okay, but I'm not sure if I'm okay, but I don't know. And then somebody's like, yeah, you're okay.
Oh, well, and we also don't spend enough time examining the good sensations in our body. Yeah. We're always like, oh, where does it hurt? What's wrong? What's bad? And so sometimes just to sit and examine the good sensations is really rewarding and fulfilling. Yeah. Even when you're learning, oh, I wasn't traumatized. Oh, it's really nice to just look into what feels good in my body.
I love that.
Yeah.
So if you're listening and you are interested in that self-assessment, we will include that in our show notes. Also, I will include Christie's website And I think, Christy, did you have a discount code to offer to listeners as well?
Yes, I did. For anybody listening to this podcast that wants to do it, there's a 4-session program for parents, for birthing people, on as one of the options to do. That's the one that I recommend most for people that have experienced any kind of traumatic delivery. And we have a promotion code for that that's 10% off.
So that promotion code is PTC, so Perinatal Trauma Center, PTC, and BBB for Bump Belly Baby, 10. So PTC, BBB, 10. And we're going to include that in the show notes as well. And you said that's 4 sessions?
Yes.
4 sessions, and are they 4 sessions 1 day apart, 4 sessions 1 month apart? How does that typically work, or does it just depend on the person?
It depends on the person, but I prefer, and I think the most effective way to do it is once a week for 4 weeks.
Okay. And then are they typically like an hour long, or how long are they?
Yeah, about an hour long. There are, well, I would say most of the time, our 3rd session is the one where we really dive into the birth story. And that one usually goes closer to 90 minutes.
Okay. So an hour to an hour and a half is a good expectation for these meetings or these sessions.
So yeah, I just want to take a moment as we're starting to wind down here to acknowledge that some of this material could be pretty activating. That, you know, if you haven't ever given birth, the idea that, oh my goodness, this experience could happen and negatively shift my life or my postpartum journey, or, you know, or if you've done it before and now you're like, oh man, yeah, that first birth was rough and now I'm scared to do it again. Like, this can be really activating. However, I don't want to leave us in that state. What I'd like to point out is all of this work with the nervous system we're doing in a body that is just simply trying to protect us and keep us alive. And so often, and I find I've started having kind of an adverse reaction to the overuse of the word trigger in our society. Everything's a trigger. Because we just put this negative information on our nervous systems when really they're doing good things. You know, fight, flight, or freeze. Those are things that are helping us survive.
Right.
You know, so even in that state of maybe feeling a little activated by this information, just taking a second to understand, okay, it's okay. My body's just trying to help me survive. Like, my body is doing the job that it's put on this planet to do, which is survive this planet. And I have the ability to discharge that. I have the ability to bring myself back into my calm, cool, collected place of appropriate social engagement with the world around me. What I do as a guide in the Perinatal Trauma Center is just help people find that. But you have every tool that you need to heal your own trauma. And so, you know, as activating as the idea of it can feel, you also have the power to do all of that discharge and all of that regulation.
I love that. Christy, thank you so much for joining us and chatting with us about this topic, and really just sharing all of the stories that kind of help us to fully understand what this is and how we can heal. To the listeners, thank you for listening. If this was something that was helpful for you today to hear, and you think maybe it might be helpful to a friend or a family member, please share the podcast. And if you haven't subscribed yet, go ahead and subscribe so that you don't miss the next episode. Until next time, thank you for listening.